penis has quite the downward curve when erect and wanted to know if it's normal. So actually, that is a great question. Today, we're back at it again, answering medical questions that you are afraid of, or maybe a little too embarrassed to ask your doctor. I figure if one person is wanting the answer to a particular question, chances are maybe multiple people are wondering the exact same thing. That's right. You guys are always flooding my comments, asking me some really awesome questions, and I can't wait to answer them. But fair warning to you all. Sometimes these questions can be a little bit strange and interesting. But today, we're not holding back at all and tackling them all. But before we get into it, I'm Dr. Jordan Wagner. I'm an emergency room doctor who treats everything from COVID to gunshot wounds, burns, you name it. I've created this video series to help answer some of your medical questions and the questions that I get from patients each and every day. If you find this video helpful, please do me a favor and subscribe. All right, let's dive right in. Is there a possible way to make yourself smarter without school/high school or university? The question ends up being, are we talking about making ourselves smarter like increasing brain power and the amount of neurons that are firing anatomy-wise, or gathering information more on a topic we're interested in? Your probably best bet is one, the internet, and the other is surrounding yourselves with people who are the gurus and the experts in the field that you want to learn about, because then you will absorb, you'll learn, and get further educated. And there are also people out there that specialize in teaching individuals how to almost like absorb material more, have better memories, and to access those memories. So there are different possibilities out there to where you can actually learn better, learn faster, and potentially make yourself smarter. Is it normal to automatically pee while taking a dump? Yes, actually, the answer is yes. You have two sphincters for your butt, and you pretty much have two sphincters for your urethra. It takes a lot more focus and musculature to relax your anal sphincters to let poop out. So then you're using the different pelvic floor muscles, and when you actually relax them, you also relax your urethral sphincters and allow urine to flow too. It is totally normal to take a dump and pee at the same time. Can I die from licking salt off an entire pack of saltines? If you can accomplish taking all the saltines out of, I'm assuming the box, the whole pack, if you just lick all of them, it's just not smart. Too much salt will lead to bloating, hypertension, a lot of things that you just don't want to happen. In the United States, most of our diets are way too saturated with salt. We put salts on everything. Salt is good to a point. We have sodium in our bodies, and we have to have sodium to have a normal functioning. Be really careful, be cognizant of licking saltines or not. I don't think you'll die from licking the saltines, but please don't eat the whole box of saltines at once. I'm not getting erections every day. How can I improve my erections so be my hardest? So there are multiple medical problems that actually can cause issues relating to erections. What can you do about it? So the first thing that you can actually do about it is address the underlying cause. So if you don't have any of those causes, then you can potentially see a doctor about medication. Everybody's heard of Viagra, the blue pill. You could also use penis pumps to engorge the penis to get it harder, that sort of thing. Because it's a real thing, and I think a lot of guys get really embarrassed relating to the fact that they're worried about getting it up or not getting it up. And don't forget, remember, there's actually something called whiskey. If you go and you drink too much alcohol, you may not be able to get a hard erection because you're inhibiting yourself with the alcohol. So just be aware of that as well, that medications, drugs can also influence how your member operates. My question is, can we regain our eyesight naturally? I hope we get there one day, but in general, when somebody's eyesight is going, it all depends on the reason why. Did you have an acute blood vessel get blocked and you have a retinal artery occlusion? Could you potentially get that back? No, because you caused ischemia to the retina and now you have dead cells to that area of the eye. Say you have macular degeneration because of diabetes. If you have your diabetes under control, then you potentially won't get macular degeneration. There's a huge spectrum of where this question goes and can we fix our eyesight per se. When it comes to as we get a little bit older, you get something called presbyopia, basically where we can't accommodate as things kind of shift in depth of what we're seeing. That typically cannot be fixed. We're not there yet. In general, right now, we don't have the natural way to improve eyesight. Question number 7. I have a friend that can dislocate his arm on command, and he said it doesn't hurt. Is that normal? Like double jointed, or should he see a doctor? Dislocating a shoulder is rough. I, as an ER doctor, have to put them back in. Typically, an orthopedic surgeon is only called if you can't put it back in or they need surgery. But if you can dislocate it and relocate it all the time, what does that mean? That basically means you dislocated enough that the ligaments, the tendons, and all the muscles surrounding the area are stretched out to where it's not holding the humeral head in the glenoid fossa, which is part of the scapula and the shoulder. And then you can actually have injuries to the glenoid rim and the labrum, something called a Bankart lesion, or basically a Bankart injury, or a Hill-Sachs injury on the head of the humerus. These also interact and play in the sense of how easy something goes in and out. If somebody is having a shoulder go in and out, you could try physical therapy to get the muscles and the tendons and ligaments to kind of try to tighten up all together. What's the harm going in and out? One, it's an unstable joint, which isn't good. And then the other component is you have what's called your brachial plexus, which is basically nerve bundles that come through your armpit from your neck out into the arm that innervate the whole arm. So if you keep having injuries, you can cause neuropraxia, injury to those nerves, which then can potentially cause permanent damage. Is it normal to generate a lot of heat when sleeping? I'm a small person, but even with a light blanket and sleeping au naturel, I heat up the bed enough to wake my boyfriend sometimes. This question actually hits home personal experience. I also sleep next to a radiant heater that is a human being, my wife. So people sleep all different temperatures. When we actually do sleep, our body cools down a little bit, a degree or two, and that is also why we like to sleep in a cooler area. So if somebody's sleeping warm, it's not necessarily anything bad. There's a lot of different factors that play into it, but there are also ways to cool yourself down. There are cooling blankets, there are cooling mattress pads, there are fans, there's ACs. There's a lot of different ways to cool your body down. There have been studies to show that if you actually sleep cold or colder, that you actually get a more restful, deeper night of sleep. So those individuals that do sleep hot aren't getting as probably a restful night of sleep as somebody who sleeps cold. Here's one for the uterus havers. Why is it that sometimes I have a period where I can barely feel a thing, but other times the pain is so bad, I cry and I'm totally debilitated? I always thought that menstrual pain is fairly consistent cycle to cycle. So actually that is a great question. Right, the menstrual cycle should be consistent in the sense of timing. Also depends on a lot of factors relating to the menstruation. If you have a light period where you're not bleeding as much, probably not going to have as much pain. If you're gonna have heavy bleeding, then you're potentially gonna have more pain. It has to do with the uterus itself is a muscle. And so the muscle is contracting, trying to kind of shed the lining of the uterus. It sheds every month. That's part of the menstrual cycle. It has to do with also trying to stop bleeding versus getting any of the tissue lining out per se. Things that can get in the way or cause horrible pain could be fibroids that are in the uterus, polyps that are in the uterus, even bad cysts on the ovaries can cause pain. And one that a lot of people don't think of is actually being dehydrated. It can cause contractions and pain that are stronger than if you were hydrated. Make sure during your menstrual period and when you're having cramps that you are well hydrated. It actually isn't that abnormal. Unless you're seeing a huge swing and a huge change, you should definitely get checked out by your OBGYN. Hello, Dr. Wagner. So I have a question for you that is a little sensitive to me. This is why I'm emailing you as opposed to social media or the comments on YouTube. So as I've gotten older, I've noticed that my penis has quite the downward curve when erect. I wanted to know if it's normal or if I should go see a urologist for this. Well, that is actually a really, really good question. We're not all made perfectly, and actually penises, they go all different directions. It can curve left, it can curve right. It can go pretty much any direction. So that is normal. What's abnormal is when maybe if it's angulated more than 30 degrees or that it continues to increase in that direction. So you've always had it at this certain angle and now you're seeing it get worse. If it's just a mild curve, that is totally normal. So if you're having any concern about your penis, please see a urologist. All right, that was another session of embarrassing questions. These are fantastic. I know sometimes it's hard to, ask questions. I get emails, I get DMs. It's fine. We will not use your name. We will not post any of that stuff. But there's so many people that actually benefit from some of the questions that are asked, even though they're not asking it. So these are fantastic. Keep them coming from ranges of anything you want. I will try to address. And if you like this video, check out this one right here. Thanks so much for watching and stay healthy, my friends.